Good evening. My name is Eula, and I am a nurse practitioner student of CSU Bakersfield. I would like to talk today about my concern with the lack of health insurance among undocumented immigrants. A large portion of this population make up our agriculture, food, and farming industry and are every bit deserving of healthcare coverage. Currently, California is the only state that allows undocumented immigrants to receive health insurance, but is limited to those 50 years or older or who meet a certain income threshold. In California today, there are 1,270,000 undocumented immigrants. So, my pitch is to see this eligibility age lowered to include children and adolescents, and to also increase the income threshold, as we are seeing families who make just over $1,000 a year more than the threshold not be eligible for insurance. In 2018, there were 44.8 million immigrants living in the United States, with California housing the most immigrants than any other state with 11 million people. Of this number, 22% remain undocumented, and unfortunately, legal status is the strongest predictor of why an individual from this population lacks health insurance. 16% of 16% of children of immigrant-born parents have no health insurance. 13% have not received preventative medical care in the past 12 months. Over 50% did not receive needed mental health care treatment, and 51% were considered obese or overweight. And as we know, being obese or overweight is a risk factor for the development of chronic diseases in adulthood. Meanwhile, in adults themselves, the prevalence of obesity increases over time with long-term immigrants. And as with children, obesity predisposes an individual to cardiovascular disease, strokes, diabetes, and amongst other things. Rates of preventative screenings for mammograms, pap smears, cholesterol, and even vaccinations are decreased among the uninsured. These are simple screening tools that can help identify potential life-threatening or life-altering debilitating diseases. Benefits of having increased insurance coverage is that access to healthcare and availability of health insurance improves immigrant health and, more importantly, can slow the trajectory of chronic disease development. We have an opportunity to improve efficiency in healthcare, meanwhile reducing costs through early detection, screenings, and education and management of these chronic diseases. But without access to primary care clinics through insurance, this cannot be made possible. Insurance eligibility will decrease emergency room visits and help decompress the emergency room, meanwhile reducing healthcare costs. It also allows for more long-term management within clinics and can promote better adherence. You must monitor the effectiveness through tracking health outcomes of undocumented immigrants within clinics. This can provide sufficient evidence that increasing eligibility is the right thing to do for this population. Thank you for your time.